When it comes to delivering the best neurocritical care, Emory University Hospital is a leader.
We have become one of the few hospitals in the metropolitan area and region that are providing 24-hour-a-day, 7-day-a-week comprehensive neurosurgical care. Our problem is we've outgrown our hospital.
Starting with the most basic need, beds. As the number of neurocritical cases grows, patients are placed in as many as 6 different ICUs. Even with that, there simply isn't enough space.
We are refusing patients at this time that need the level of care that Emory Healthcare can provide.
So what we need at Emory for the short term is we need a new neurocritical care service that can consolidate patients into one area where we can focus the mass of people and equipment and expertise in one area rather than spreading those resources all over a hospital.
But we didn't want to build just another ICU. We wanted to create the intensive care unit of the 21st century.
We're not just about talk here, we're about action. And the action is that we are doing what the literature says to do in creating the best healthcare design for best care, best outcome.
That meant bringing everyone to the design table. Doctors, nurses, even patient families were involved, coming together for events like this charrette to give their feedback and insight. And we didn't stop there. We took their ideas and actually built a mock-up of the unit and invited everyone back to try it out.
They videotaped, they took notes, they took pictures. We would set up the scenarios, we would discuss the scenarios, and then get feedback as to how we could improve the design.
A goosebump moment. That's what you get. You get a goosebump moment of saying we can really come up with some extraordinary solutions where each individual group would have never thought of.
The innovative solutions in the new design are everywhere, from room arrangements that allow caregivers 360-degree access to beds to a variety of charting stations, including one with a view of the patient room. The new ICU will even have its own CAT scan machine, dramatically reducing the time and trauma of transferring critically ill patients. And the improvements won't just help patients and caregivers. We also recognize the special challenges facing patient families. Families like the Patels, who spent months by their daughter's side, virtually living in the hospital.
No, I don't want to leave. Whatever happened, I don't want to leave from here. I want to be with my daughter all the time.
Right now, the challenges for a family like the Patels are daunting.
They'll, put all the supplies, blankets or whatever they need, they'll put them in a corner and sort of families stake out their areas in a waiting room.
So there should be more facility for the restroom. There should be more facility on the sleeping side as well. There should be some room where everybody can go and sleep.
In the new ICU, that is exactly what families will have. A room of their own beside their loved one. A room that can provide privacy and security.
This is one of the most remarkable features of the whole ICU because it provides them access to their family members, access to natural light, but a chance to get away a little bit if they need to do that.
They're going to have washers and dryers where they're not having to worry about laundromats or a hotel to get things clean. They're going to have showers.
This is never going to be home, obviously, but we want this to be as comfortable and as humane as possible given the fact that their family members are going through a catastrophic event.
Better care for families, better facilities for delivering care, and most importantly, better results for patients. As the ICU nears completion, excitement is building.
I think excited is an understatement.
I think I'm proud. I think I can use that word, proud, of what I believe Emory is doing.
A year from now, you may have to stand in line behind Mayo Clinic, Mass General, UCLA to see the right way to do neurointensive care.
It's an exciting time when people say, wow, look what we did.